The SCOUT trial is a trial that is utilizing catheter therapy to treat people with severe tricuspid regurgitation. Previously, patients with severe tricuspid regurgitation were left with either medical therapy, which is often ineffective, or open heart surgery. So this is a technology that is utilizing catheters to treat people with tricuspid regurgitation and avoid open heart surgery and overcome the limitations of medical therapy. Patients that have tricuspid regurgitation with any degree of surgical risk are eligible for this trial. They do not have to be high risk, as we often did with people with transcatheter aortic valve therapy. It is leaking of the valve on the right side of the heart, and that is a valve that regulates blood flow into the lungs and also regulates blood flow that, when it backs up, can cause swelling, fatigue, and shortness of breath. It's diagnosed primarily initially by symptoms, and then when patients have symptoms of fatigue, shortness of breath, leg edema, they undergo a echocardiogram, and that's where often this phenomena is best diagnosed. Typically, these people will have what's called right-sided heart failure, which is edema, shortness of breath. The trial is just begun in the U.S. in 4 centers. We treated the third patient in the country with this technology. The trial is designed by the FDA to be a feasibility trial and is not randomized, so any patient that is eligible can be treated and does not have to necessarily receive medical therapy or surgery. Current treatment for these patients would be medical therapy or surgery. We're looking to build on the success of transcatheter aortic valve replacement. I've been involved in treating people with valvular heart disease for over 20 years with catheter-based therapies. We've had tremendous success with this therapy in the aortic valve area. We're starting to work in the mitral valve area, and the tricuspid valve becomes obviously another target that we'd like to be able to treat patients effectively and avoid surgery or avoid the limitations of medical therapy. So I wouldn't term it as surgery, I would term it as a procedure. And it's done through the vein in the neck, and we bring a tube or a catheter through the vein in the neck into the right side of the heart, and under the guidance of a transesophageal echocardiogram, we place 2 sutures that take the orifice of the tricuspid valve, which is enlarged, and narrows it to a degree that overcomes the leaking that's in the valve. The procedure has been very effective in the patients that have been treated. Primarily in this country and in Europe, there's only been a small number that have been treated at this point in time, but it has effectively taken this severe tricuspid regurgitation usually down to the mild range. It's an excellent question. I would say that there is an awareness of the pathology, but the therapy awareness is really just developing. And if we again harken back to transcatheter aortic valve work, there was an educational process to the physician community, both cardiologists, cardiac surgeons, and internists and primary care physicians, that there are other treatments available besides surgery. What we found was people were not being referred because people thought all they had was surgery as an option. And we know that, for example, aortic valve disease, without a valve replacement, the prognosis was poor. So there is a re-education of the medical community anytime these technologies become available to understand that, gee, there may be other options. And once again, I would encourage patients and families to look at the internet and see what's out there, because in times the self-referral of patients and them learning about it before their primary care provider knew about it was not unusual and still not unusual. Patients often feel excellent relief as far as their symptoms of heart failure, shortness of breath, and fatigue. And this is a therapy that's really geared toward improving symptomatology in the patients and avoiding the surgery necessary in the past for this problem. No, I wouldn't quite say that. I would say that they are effectively treated. The regurgitant or leaking valve has been minimized at that point to the point that it no longer becomes a problem for these patients. What we don't have yet is long-term data on these patients since it's a new technology. But we do know in the short term it has a dramatic improvement in their lifestyle and in their symptoms. So the beauty part of this thus far is we've not seen any serious safety concerns. Having said that, anytime we undergo a procedure, there's always concerns about potential for complications, and I think those have to be monitored very, very closely. But in the early going, the safety profile seems to be excellent.